Thank you so much for joining Integral Care for this special virtual community forum about how the power of lived experience changes lives. My name is Deborah Rosales Elkins, and I'm a certified peer support specialist with Integral Care. Integral Care is the local mental health and intellectual and developmental disability authority for Travis County. We've been supporting adults and children living with mental illness, substance use disorder, and intellectual and developmental disabilities for over 50 years. We have 21 peers on staff. Before we begin, I'd like to thank NAMI Central Texas for joining us today and for their ongoing collaboration and support. They do amazing work in our community to improve the lives of all individuals affected by mental illness through their education, support, and advocacy programs. I do want to let you know that we are recording today's forum and will also be broadcasting on Facebook. Studies from across the country reveal that integrating people with lived experience into our healthcare improves a person's relationship with providers, their social support system, and their overall health and well-being. We have a wonderful panel for you today, all bringing different perspectives and backgrounds to the table. Lived experience comes in a variety of forms. There's the peer support specialist. We are people living with experience with a mental health condition. We are credentialed, and we're part of a person's care team. At Integral Care, we work alongside clinicians, psychiatrists, therapists, and case managers to help our clients. We model coping skills and lead support groups, and we serve as mentors who give clients the tools they need to advocate for themselves. This can also include recovery support specialists who support clients in maintaining recovery from the overuse of alcohol and other substances. They are peers with lived experience who work with others with mental health issues, leading classes and support groups. A certified family partner is a parent or guardian who has lived experience raising a child with mental, emotional, or behavioral health challenges, and has at least 1 year successfully navigating a child service system. They are trained to use this experience to help other parents and guardians for the purpose of education, role modeling, and providing hope. We are all walking together. The peer, the advocate, the family partner. We each have a valuable and valid perspective that we bring to the table. Because people with mental illness need mentors, parents need training, and the larger community needs our voices to better understand the paths that we walk. We'll have each of the panelists share their personal story and what brought them to this work, and talk about how they've seen lived experience change lives and improve outcomes. Now for some housekeeping items. We'll have about 20 minutes at the end of our hour to answer your questions. So submit your questions by typing them into the Q&A feature you see at the bottom of your screen. I'd like to kick things off by sharing my personal story and how I came to be a peer support. I was diagnosed in my mid-20s with a bipolar disorder, and I probably should have been diagnosed a lot sooner than that. When I first got my diagnosis, I couldn't accept it. And so I began a yo-yo kind of journey where I would take medication, feel better, do better, and then I'd think, you know, I'm a strong, independent woman. I can navigate this disease without medication. And unfortunately, I'd get sick again. I did this for a few years. And as we know, mental health challenges have a biological run through families. It wasn't until I lost a nephew to suicide that I started to take this illness very, very seriously. I decided at that point that I was going to take the bull by the horns and learn all I could about how to navigate this illness and be as resilient as I possibly could be. You know, the help really did help. My psychiatrist, my therapist, my medications. But the most impactful thing for me was learning from those who have walked this journey before me. I have a short story I'd like to share about my perspective on peers. Imagine that you're in this deep, dark hole and you can't get out. And a clergy walks by and you say, "Pastor, I'm in this hole. Can you help?" And they say, "Well, of course." And they write out a prayer and they throw it down the hole. But I'm still in the hole. And then a physician walks by and you say, "Doctor, I'm in this hole. Can you help me?" And they say, "Yes." And they write out a prescription and they throw it down the hole. Again, I'm still in the hole. And then a peer walks by and you say, "Buddy, I'm in this hole. Can you help me?" And before I know it, they jump in the hole with me. And I say, "Why did you do that? Now we're both in the hole." And the peer says, "Yeah, but I've been here before and I know the way out." This is what I hope peers bring to the table. We're in mutuality with people. We advocate for people. And most importantly, we help people learn how to advocate for themselves. I'm going to hand it over to our wonderful panel that we have. I'd like to introduce our first speaker, Shannon Carr. Shannon is a certified peer support specialist. For the past 18 years, she has been executive director for Austin area mental health consumers, which supports and advocates for a consumer's right to achieve mental wellness, self-empowerment, and self-sufficiency. She serves on the Texas Peer Support Stakeholders Work Group and in other advertisory roles, promoting wellness and recovery. Shannon, I now turn it over to you.
Thank you so much. I appreciate you, Deborah, and what a lovely, just a lovely story that you have. I just wanted to let everybody know that part of being a peer is something that I think that has been instilled with me all my life. I am from a family or siblings of 8, and I am the oldest daughter. Our oldest brother has passed. So when it comes down to everyone needing to get that point of view or to get some assistance or that go-to person, it was always Shannon. So I became like the big mama, as we would say in our community, just to help my siblings through whatever. You spoke a little bit, Deborah, about just the historical issues that happen regarding mental health and substance use, and it's true. In my family, it's a lot of the substance use and the mental health issues. And so I became more of a family member, taking care of my brothers and sisters, the phone calls happening at 2, 3, 4 o'clock in the morning, the stressors that went with that. But at the same time, I wasn't taking care of myself. I was coping in a different way, not in a very healthy way. I can definitely say that I've been diagnosed with depression and anxiety disorder, but I never really thought anything of it, as you said as well, Deborah. It was just one of those things where it's not about me. It's about taking care of my younger brothers and sisters. And that's how I basically focused my time until our stepmother passed. And that was when I had to step back and say, okay, it's time to take care of myself. It was a 5-week, very hard journey of getting myself back on track. Next slide, please. Along with that, just the whole idea of wanting to give back, not only to myself, but give back to our community. Always have been someone, when I went to school at Howard University, I went for being a social worker. I loved that type of give back and feedback and wanting to help someone all the time. But at the same time, never really helping myself. I knew what to say. I know what to do and how to do it, but I never took that information on myself. Very late in the game, I started looking into the Shack and the Self-Help Advocacy Center. And at this particular place, I was there as the executive director, wanting to switch things around, have a role in a sense to where we're here for the community. No matter who you are, what you are, how you got there, we're gonna be there for you. So when I'm looking at the Shack, I was basically there to get programming started, get things happening. But again, not taking care of Shannon, always taking care of everybody else. We went through WRAP, Wellness Recovery Action Plan training. I became a facilitator, but it was just a facilitator. It was something, again, to give back to the community. Went through becoming a certified peer specialist, again, to give back to the community. But then I started thinking that a lot of these tools and techniques that I'm learning, I could use them for myself. And that's when I really started getting my aha moment. And it's a lot of aha moments that happen. Even I'm not gonna say I'm a senior citizen, but I am someone who is up there, and it is something to where I learn something every single day. Every day it's something new, and it's a different way. Even right now during COVID-19, I learned more about myself, and I learned that my wellness tools and my wellness strategies and my recovery strategies are changing daily because we're dealing with something different. Next slide, please. And so then we also start thinking about, well, what can I do to also help myself and help the things that are going on in my community? And just looking, these are some of the things that we do at the Self-Help Advocacy Center, which is Austin area mental health consumers. My journey has always been to give back, has always been to help someone else. But at the same time, I never realized that those tools and techniques that I was given was also for myself. And so I had to start thinking back about how these peer services that we've been learning, that we've been taught, that is going on, is to help me. And the more I give back, the more I've realized that I'm helping myself. Through the peer supports that we do, through our one-on-one peer mentor program, when we actually are sitting and talking to someone on that individual basis, just like your story, Deborah, in that hole in the trenches with them, to have that conversation, to know that, okay, we're gonna get out of this together. It's not you alone. And I think those are some of the ideas that I had as I was continuing to become of age, is I thought I was alone. African-American young lady, all in church, never really had many issues, or, you know, at least in my eyes. But at the same time, I felt alone, had friends, had everything to do, but I felt alone. Next slide, please. So I just want to encourage everybody to continue with what you're doing, continue with being empowered. And if you have not been empowered with taking control of your wellness, you always have a peer to help support you in whatever way we can. So I'm gonna turn this back over to Deborah, but thank you for listening to my story.
Thank you so much, Shannon, for sharing. Now let's hear from Valerie Milburn. Valerie is a recovery and mental health advocate. As a person in long-term dual recovery, she devotes her time to reducing the stigma that surrounds substance use and mental health disorders. Valerie is a volunteer, presenter, class mentor, and state trainer for NAMI Central Texas. She also serves on the board of directors as a peer recovery coach for Communities for Recovery. Thank you for being here, Valerie.
Thank you. Good afternoon. I'm Valerie Milburn, and I'm a person in long-term dual recovery. For me, that means I haven't had a drink or a drug since October of 1999, and that I live in recovery with bipolar disorder. I want to thank Integral Care and NAMI for hosting this panel today and for asking me to participate. It's an honor to be here. I tend to procrastinate, but as it was taking me a while to get going on preparing this presentation, I realized I wasn't procrastinating. I was thinking through a dilemma. I have so many examples and thoughts and stories of people's lives being changed because of this power of shared experience that I didn't know where to begin. I've shared my lived experience with bipolar disorder and substance use disorder from so many different roles. I've been a peer as a NAMI volunteer, as a board member and volunteer for Communities for Recovery, as a friend, as a family member, as a member of the 12-step community, as a peer recovery coach. Thinking through all these examples of my peer work as part of my recovery journey, I didn't know where to begin. But thinking through all these examples, one particular role came back again and again, so that is where I'll begin. When I was a volunteer for Communities for Recovery, I led a dual recovery meeting every Tuesday morning for 9 years at one of our local psychiatric hospitals. Dual recovery means focusing on substance use disorder and a mental health condition. I always started that meeting with a quick version of my story so I could connect with patients. I shared that I had 7 psychiatric hospitalizations, that I first struggled with depression in the 7th grade, and that my manic episodes kicked in college. I shared that I had my complete breakdown in my 30s, that it took me 5 years to get sober, that I had to leave my family for a while and live in a sober house, and that I had periods of deep desperation and despair while I was fighting to get well. I always ended with the fact that I did win that fight, that I do live in recovery, and that I work every day to stay in recovery. I wish I had time to share all my memories of those years working, leading that meeting, but I'll share a few of my favorites. The meeting format was such that we got to know each other pretty well, and after the meeting, I often had time to visit with patients. One particular comment stands out. A woman once said to me, "Considering your history, the fact that you're here at 9 o'clock in the morning with clean hair, your makeup done, and cool boots on gives me hope for the first time in many years." Another woman said, "I have 7 days clean and you have 7 years clean, but you were once in a psychiatric hospital with 7 days clean and you made it. I can do this." A young man once said, "The fact that you have a badge and a key to that door shows how much we can change." Another way I share my lived experience is as a presenter for NAMI. NAMI is part of the training for the crisis intervention teams for the Austin Police Department and the Travis County Sheriff's Department. I have the honor of being part of that presentation. It is so important that I share my journey with law enforcement officers. Just as the nature of their job, when a law enforcement officer has an interaction with someone with a mental health condition, they are often seeing that person on one of their very worst days. I know that was the case for me. But now, when I share my mental health journey with officers, they're seeing the face of recovery. They're seeing the person, not the disease. The comments from the officers on the presentation evaluation are very powerful. One of the most common comments is the officers say that after hearing the stories of people living in recovery with a mental health condition, they have a totally new perspective on the interactions they have with people in a psychiatric crisis. Now that's breaking down stigma. I've done much of my peer work in the 12-step community. The 12-step model, the 12-step program may be the original peer model because it was founded in 1936. For those of you not familiar with the 12-step community, it's basically one peer leading another peer on the path to recovery using a few simple tools. The 12-step path isn't everybody's path, but it's been mine. And in my almost 21 years of being clean and sober, I've shared my experience peer-to-peer with hundreds of women and seen many of them go on to get sober and completely change their lives for the better. I've seen many other men and women get sober and live happy, healthy, productive lives. My journey has had a ripple effect through my friends and family that I never dreamed of. My college friends who saw me struggle and suffer for many, many years now ask me to meet and mentor their own college-age children who are suffering and struggling. My daughter is another example of this ripple effect. My daughter's here with us today. Hey, sweetie. My 35-year-old daughter and I are very close. We talk often of our journey through my addiction and mental health struggles. She, in turn, shares our journey with her friends whose lives are touched by the same struggles. She supports them with compassion and wisdom and her entire heart. So you can see that shared experience does change lives, even across generations. I've talked about how shared experiences does indeed change lives, but not only does it change others' lives, it changes my life. Knowing that my dark past is a shining light for others has given meaning and value to my story and a new purpose to my life. Thank you.
Thank you, Valerie, for sharing your wonderful experience. Next up, we have Nydia Heston. Nydia is a master social worker and master level certified family partner. She is the family partner coordinator at Via Hope, overseeing training and certification for providers of parent peer support. Nydia has worked directly with families for over 20 years in navigating systems of early childhood, education, mental health, intellectual, developmental disabilities, and the medical community. She and her husband have lived experience raising a son who lives with autism, ADHD, mood disorder, and post-traumatic stress disorder. Welcome, Nydia.
Hello, thank you. Thank you all for joining us today and for listening to our stories of peer support and our journeys. So today I'm going to talk about the gift of my job, which on the next slide, as you can see, is my son, Quinn. So my lived experience as a parent peer support comes through our lived experience of my son, Quinn, who I refer to as a gift of my job. As early as 2 years old, my son began to display some behavioral challenges and some developmental delays. He was nonverbal till he was about 5.5. By the age of 3, he was diagnosed as being autistic. And so then our journey of searching for supports at school, in the community, and pediatric medical systems began. While I was not formally working in the field of peer support, I joined lots of peer groups and support groups where other people offered that peer support, including resources and emotional support. In 2007, 3 years after my son's autism diagnosis, and after seeking out services and supports and navigating all kinds of systems and coordinating treatments and treatment teams, I saw a job posting at our local mental health agency for a family partner. I thought, what? An organization wants to pay a parent who doesn't have a degree to talk to other parents about how to navigate systems and provide emotional support? Like we could go and do this over coffee? I couldn't believe it. I was absolutely flabbergasted, but was excited at this possible opportunity of being able to share our lived experience with other parents and caregivers. 15 years later, as we continue to navigate those systems to find supports for additional diagnoses that have manifested over the years, the gift of my job continues to grow into adulthood. Over the last 4 years, my son has been a homeschooler, and being outside of the public school system, we've had to learn some of these systems of navigating job training and internships in order to practice some of those job skills. We've had to do a lot of that on our own. So as a family partner or parent peer support, this journey of navigating systems just continues throughout really a lifespan. And I'm so grateful for the adult peer supports sharing their story and offering to help those that come after them. I'm so grateful for them to know that my son, as he grows older, will have this opportunity to receive peer supports from other providers as well. As the next slide shows, I've worked as a family partner for over 10 years and have had the privilege to walk alongside many families in this journey of mental health. And one particular family stands out. When I met this mom, it had been about 6 weeks that she had been released from prison. She had 4 sons, and in her words, she was desperate to be a good mother. At discharge, which was about 2 years after beginning working with her and her family, she had gone from living in a relative's shed while her sons lived in the main house to having her own apartment and having her sons live with her, which was her goal for her family. She had completed her GED, and she was also seeing one of her sons off to college. These were all things that just 2 years prior just were not things that she thought were at all possible. But what she was most proud of was feeling empowered to navigate her son's mental health challenges on her own and knowing where to find resources and supports when she needed them. During our last meeting, she shared with me how she was helping other parents in her apartment complex as well. And she had even taken a Texas parent-to-parent volunteer training to be a parent mentor. As a certified family partner, our motto in working with caregivers is do for, do with, and cheer on. Our greatest joy is when we move through onto the cheer on phase when working with caregivers and parents. As you can see, what we do as family partners is our main goal is to emotionally meet families where they are with heartfelt empathy and compassion to cultivate hope and empowerment. Since we with lived experience of navigating systems for our own children, we know what it feels like to make those phone calls, to have those school meetings, to meet with physicians, to really have to explain how our child's mental health challenges are impacting them in their lives. We can really meet with families where they are and really be empathetic with that. We empower families by supporting them as the expert who knows their family strengths and needs. We help them practice self-advocacy. We help families understand how life experiences can impact a family and the youth's emotional and mental wellness. And all of this, our hope is that it cultivates hope in both the parents, caregivers, the family, and ultimately the youth, so that they can move through, so they can feel empowered and stand in their own knowledge that they can have the life that they want and meet their goals. Thank you so much for taking this time, and I'll send this back to you.
Thank you so much, Nydia, for sharing your powerful story. And finally, we have Mackenzie Ulam, a rising senior at the University of Texas at Austin, majoring in psychology. This coming year, she will serve as the president of NAMI on campus. Mackenzie facilitates peer support groups on UT campuses and is part of UT's mental health peer education program. She is employed by UT as a peer mentor, where she leads a seminar for first-year students dedicated to easing the transition from high school into college. Welcome, Mackenzie.
Thank you so much, Deborah. And I just wanted to start off by thanking Integral Care in NAMI Central Texas for thinking of NAMI on campus and for having me today. It's really such an honor to be able to sit here with all of you amazing women, many who are old enough to be my own mother. Next slide, please. So, like Deborah mentioned, my name is Mackenzie, and these are kind of some of the roles that I play at UT. And I'll be talking about each of them as we go on throughout my presentation. So I want to start off by talking about my own college experience. So I started off with a really rocky start. I got to UT and I found myself constantly having panic attacks while trying to navigate campus. And shortly after that, I got diagnosed with multiple anxiety disorders and I started going to therapy for the very first time. And this all happened in my first semester of college. So after going through that is when I really decided that I wanted to dedicate myself to supporting others who go through the same thing while in college. And during this time, really the only outlet that I had was NAMI on campus. And it was in NAMI that I learned about the prevalence of stigma that's associated with mental illness. But luckily, this group is the reason that I was finally able to talk about everything that was going on with me. Next slide, please. So 75% of mental health issues begin by the age of 24, and nearly 40% of college students will experience a significant mental health issue while they're in college. But 67% of students will tell a friend that they are feeling suicidal before they'll tell someone else. So what all of these statistics are saying is that college is a great time for mental health intervention, especially for peers. I think that peer support is a vital place where students are much more likely to listen to another student and tell another student what's going on behind the scenes. Next slide, please. So NAMI on campus is really my home at UT Austin. We've only been in organization since 2016, but we've grown a lot each year that we've been on campus. Currently with NAMI on campus, I help facilitate NAMI Connection support groups that we brought to UT's campus in the spring of 2019. And you can see in that first picture there, at the very end of my training, where me and one of my friends got finally certified to be facilitators. This past year in NAMI, I served as an officer on the officer board and I managed membership information. And starting in the fall, I will be the president, which I'm insanely excited about. Anyone that you talk to in NAMI on campus will tell you about how this organization has helped them break their internal stigma surrounding their mental illness. And a lot of them will also say that being in NAMI is what has helped them inspire to help others to do the very same thing. And that's exactly what my story is here. In the two other pictures on this slide, you can see us at NAMI Walks in fall of 2018 and 2019. And I have to say that NAMI Walks is an incredibly empowering experience, and I love everything that it's doing for us. Next slide, please. So this leads me into a few of the other roles that I have at UT, which I took this past year, my second year here at UT. So I became a mental health peer educator in fall of 2019, and this is actually a 3-semester program that I will complete in fall of 2020. As a peer educator, I'm equipped with mental health resources that are specific to UT's campus, and I give workshops to student organizations on topics such as stress management and resiliency. I found that a lot of times other students have not heard of these resources before or don't know stress management techniques, and it's really empowering to see the reaction to students when they hear that there's something they can actually do about all of their stress that they're facing in college, especially at a campus like UT where it's very competitive. Another part of the peer education program is that I work in smaller committee groups with other educators to develop new programs on campus. A few of the programs I've worked in are Mental Health Promotion Week and Suicide Prevention Week. And a new thing we're working on is storytelling groups, where we'll go into student organizations and facilitate groups where they can really talk about what's going on. Next slide, please. Next slide, please. So the last thing I'm going to talk about today is really close to my heart, and this is something that Deborah mentioned in my bio, and it's called a FIG, which is short for a first year interest group. A first-year interest group is a group of 15 to 20 freshmen who are in their very first semester of UT, and they share 2 to 3 classes together. And with a campus like UT that has 50,000 students, having a class, more than one class with anyone, is kind of an amazing feat. These FIGs are led by a peer mentor who runs a 1-hour-a-week seminar aimed at different topics that will help students get acclimated to college campus. And this was my role in this FIG. Some of the topics that I facilitated include productivity, mental health, and healthy eating. So what I really did as a FIG mentor is that I used my position to bring light to all of the struggles that I have found are universally faced by freshmen when they come onto college campus for the first time, but no one really talks about it. So from the very beginning of my FIG, I made it a priority to disclose my own struggles in my own first year of college and my experience with getting a mental health diagnosis for the first time. I saw the impact of this self-disclosure immediately. As a part of my position, I met with each of my students one-on-one, and I took the time to ask each of them how they're actually doing and how their mental health is holding up during this time. I was really excited to see my students actually open up to me and tell me about what they're going through. Some of my really shy students who hadn't talked in class before were brave enough to tell me that they actually had an anxiety disorder or were struggling with depression at the time. And throughout the rest of the semester, I got to see all of my students really come out of their shell and grow into wonderful people, and it was such an honor to see that. I even managed to get 3 of my students to join NAMI on campus, and now we're all a tight-knit friend group. So I just wanted to end by saying that there is real change happening on college campuses. There are students that are becoming a lot more vocal about mental illness and their experience with it. There is still a distance to go with breaking the stigma, but I'm really excited to be a part of the process. Thank you.
Oh, thank you, Mackenzie, such a gift. Thank you so much for sharing. We now have 15 to 20 minutes for your questions. Submit your questions by typing them into the Q&A box you see at the bottom of your screen. We may not have time to get to all the questions, but we'll do our best. So let's start with this question. Panel, what do people most commonly need help with?
I'll kick it off. One of the things that's often just the very first thing I hear about is people looking for hope. I hear people often as a peer, I interact with people who are very early in sobriety and are dealing with their mental health struggles. And they just want to know, does it get better? And as a peer who's been there, I can say, if it got better for me, it can get better for you. And it's just that basic peer-to-peer connection. It's like Deborah said, being down in the hole with them and saying, I've been here before and I know the way out. And it's just really powerful.
Thank you so much. Anyone else?
This is Shannon. I also think that what people are looking for is just a way to navigate. Just here in Austin, our system is so huge, whether it's private or public or otherwise. Just being a peer and being able to talk to someone saying, okay, at this particular location, you're going to be sitting there for 3 or 4 hours. So bring, something to keep yourself calm. We'll be there to help support you. I'll call and check on you. You can call us at any time. So just navigating the system is a real challenge, especially when you are in crisis. And that has been one of the things that we help with a lot.
Thank you. Anybody else? I would just like to add, sometimes it can be so simple that clients will ask me, how do you talk to your family? Do you tell friends? Do you disclose? And we have rich conversations about what is best for them and how to decide how to move forward.
Hello, I'm monitoring the questions, and we have one from someone in the audience that says they enjoyed Valerie's comment that a client made about seeing you with your hair washed and makeup on at 9 a.m. gives me hope. And she's wondering, do any of you have a client success story that you would like to share?
This is Shannon. So I've been around for quite some time. Do I have one? No, we have a lot, but I can, the quickest one I can tell you is there was someone who had come in, the initial single point of, just being in crisis. And our peer, once she came in, she said, I'm taking my medicine, everything is good. I'm going to groups, attending here at our office. I'm ready to get back into the workforce. But at the same time, one of the things that we talk about is what part of the workforce are you ready for? You may not be able to go back to what she was doing in a case. She was from Houston, and she worked on a huge PBX system. And I don't know if everyone knows what that is, but it's like thousands of phone calls coming in at one time, and she's able to navigate those and move them around. We have a volunteer program here at our office. And so we said, why don't you get on our phones and start working with that and see where it takes you. To make a long story short, we have one phone line, lots of phone calls coming in, and that tended to be a little bit of a hassle for her. It was something she was not able to do. So retraining your brain sometimes is something that we call it here, where you may not be able to do the same things you were able to, but you still have strengths and you still have other qualities in you that you can navigate somewhere else. She is now her own private attorney. I'm sorry, not attorney, accountant. She figured that being, in a situation where she could talk to people when she needs to, but she can definitely work better and focus, on accounting and things like that. And she actually started doing that at our office. And now she's her own CPA. So kudos for Miss K, if you're out there.
Oh, that is so wonderful, Shannon. I would just like to share a quick story. I'll never forget a client that I had who was really going through a hard time. She had had a break and had to quit her job and was trying to rebuild herself up. And she asked me about my life. And I just quickly shared that I was happily married for 30 years and that I had raised 5 resilient children who all had careers of their own. And she broke into tears. And she said, "You mean to tell me that I too can have a family and children someday?" And I said, "Absolutely." It's funny how we forget that people can build themselves up and do anything they want. Anyone else want to share?
I would like to share a story quickly. I did share one of a family that left an impression on me, but another family that I'm thinking of, she was a mother to 4 children. Her 2 youngest were twins. And she had just really become overwhelmed with her own mental health, her own mental wellness, and taking care of her 4 children. She was recently had become a single mother as well. And she just really felt like she had a very mousy voice when she did speak, didn't feel very confident. And I worked as part of their team for about 4 years. And I think I left because I moved on to a different position, so I didn't finish discharge with this family. Several years later, I ran into her, and she was just a completely different person. And she just kept saying how grateful she was to have had the support of a parent support specialist or certified family partner, because it gave her the confidence. And whenever she felt like she couldn't do something or navigate or advocate in the way she needed to for her children, she just remembered how having a family partner just alongside with her helped to empower her, and that she could do this. And it turned out that at her children's school, she had become kind of a peer support specialist as well. She wasn't paid, but she had moved into that role, and the school was really using her in that way. So again, just to hear these stories of caregivers or parents who really feel empowered after engaging in that peer support, it's really amazing.
Indeed, it is.
So the first question we have from our viewers is, how do you take care of yourself when you're taking care of others?
Boy, I just recently did a webinar on this, and there's just so many things. But one of the things that has been really impactful for me is just finding examples of other people who've walked the journey. I really like doing research and reading books of resiliency, of people who had my particular disorder and how they've navigated and overcome it. So that just, you know, is another way to get the information about peers out in the world and how they've moved forward. And I just find that's the way I take care of myself, because it inspires me. What about the rest of you?
I have to be really careful about managing my stress. Any bumps I've had in my recovery have been caused by a lot of stress. And I spend quiet time every morning, getting centered and focused for the day. I try to walk or do something active every day. My sister's been pushing me during this stay home time to do 4 miles with her every morning, and I've been pretty good about it. I appreciate her. I definitely get 8 hours of sleep a night. It's kind of a written prescription from my psychiatrist that I have to sleep 8 hours a night. I do a lot to take care of myself. I keep structure in my day. I have to focus on my well-being at all costs, because if I'm not well, I can't help anybody.
Okay, another question is, thank you so much for sharing your stories, was the comment. Would you throw some light on how your families and friends reacted to your experiences with mental health?
I can go ahead and start off with that one. I think a lot of times, especially initially, I was considered Big Mama. I was the one who, doesn't matter what's going on with me, I need to take care of family. So when my stepmother passed, that's when I really just said, okay, look, you guys, this is what's going on with me. This is how I need your help and support. I was really front with it. I do have an aunt that decided that if I touch her, she would get it. It was hard to gather that, but I also know that at the same time I had to be true to myself, and I had to be true to who I am. I not only am a person with lived mental health experiences, but I also have diabetes. So I'm not going to have either one of those control me. It's a part of me, you know, just like a limb or my facial features. It's a part of me, but it's something that I help to manage through my life. And if there are people who just don't quite get it, maybe later she will, but at this particular time, I have to work with me and focus on me.
Beautiful.
I'm really lucky that I had parents who were really accepting and receptive when I told them that I was getting diagnosed with multiple anxiety disorders at college. I wasn't living with them at the time. I was 4 hours away at UT. My parents live in Dallas, so a lot of it really was kind of on my own in terms of finding therapy for the first time and taking all of that on my shoulders. But I had parents that, even though they may not have completely understood exactly what I was experiencing, they still validated that. And I know that's not the case for all college students, so I'm really lucky in that aspect.
We have another.
Oh,
sorry. We've got a question saying, I have a daughter that struggles with anxiety issues. She just told me about this as an adult. How can I help her when she exhibits anxiety?
I guess as a daughter with anxiety, I can speak to this question. I think a big way you can just start off is with validation, validating everything that your daughter's feeling right now. I know that anxiety doesn't make a lot of sense sometimes, but if you tell your daughter that, she's likely already thinking about it. So just kind of validating her experience and telling her that you're there to support her, even if you don't exactly know how, that's something that you can work on building communication with.
And Mackenzie, it's such a great answer. I just wanted to add one of the things that I did with my family is I spent some time thinking about what help looks like to me. And I actually had a conversation with those who love me about what that looks like. And first I had to figure that out myself, because that was a journey. But I think as a parent or a guardian of someone who has mental health issues, asking them, what does help look like to you, can be a wonderful conversation starter.
So this question is for Deborah and Valerie. How old were your children when you shared your mental health issues with them?
I didn't actually come out at any point and say, this is what's going on with me. My kids were very young. They were 7 and 9 when my crisis started. And as they got older, at the appropriate time, certain things were shared when it was organic and the time was right. So that by the time they were, 18, 19, 20, they kind of knew the whole story, but they didn't need to know everything at the same time. It just kind of unfolded as it should have unfolded, as they were the right age.
When I lost my nephew to suicide, I decided no more hiding. My kids were 12 and 13, about to enter adolescence. And the more I was learning about mental health challenges, well, that's when things can start really showing up. So I was very open about my diagnosis. And the way that I really, and I made lots of mistakes along the way. I don't know if you all are familiar with Kristen Bell, but she tells a wonderful story of her mom sitting her down and saying, hey, we've got this thing in our family that you may struggle with some sadness. She didn't call it mental health issues, or, times when you're not able to cope. And guess what? All you have to do is call me, because I've been through this before. And I know that I don't mean to make light of mental health issues, but what a beautiful way to present that to your daughter, as if, hey, this has got normalcy around it. We know how to handle it in our family, and help is available. So I really liked that.
I just have to share one comment that came in. It says, I thank each of you so very much. I thank you for your service to the community and for your testimonies. One question that came in is, what might be some concrete markers of success in mental health recovery akin to days of sobriety and substance use recovery?
Concrete markers of success?
Yes.
I don't know if there are concrete markers of success. Success is such an individual thing. I know for me, the markers of success were so small because my journey took me so low. I mean, there was a marker of success that was, used to be if somebody spilled a Coca-Cola in the sink as they were rinsing the glass and they didn't rinse the sink so that there was brown stuff all over the sink, I would just have a fit and scream and yell. And then one day, about 18 months sober, I walked in the kitchen, saw the brown stuff all over the sink, and I just rinsed the sink. And for me, that was a huge success, to not yell over something ridiculously small. Another success was I went back to work. I hadn't worked in 18 months. And I went back to work. Another success was I built a new career because I had trashed the first one. For other people, it was getting a real estate license back after letting it lapse as they were deep in their mental health struggle. For others, another one for me was moving back home after being in a sober house. There's so many success steps in a journey back into a happy, healthy, productive life. Getting your family back. There's just so many that are concrete, that are little pieces of hope, that are small behavior changes. Every day got better for me, a little bit every day. So I think it's individual celebrations.
Mackenzie, this is a question for, I'm sorry, go ahead.
I was gonna say, I would agree with that. I know with my son being 17 and with teenage and adolescence and just all of those emotions in and of themselves, finding concrete success can be difficult. Really, it's what he feels is a success. On Friday, he took the first of 4 GED exams and passed it, and that was huge for him. For me, I'm just excited that he's emotionally in a well place. If to me, academics is a plus, but he was so excited about that. So that was his own concrete success, if you want to call it. So we definitely celebrated that with him. So I think it's very individual, the way Valerie said, to each person.
The last question for Mackenzie before I hand it back over to Deborah. Have you seen stigma reduce overall on the UT campus in your time there?
I definitely have seen the stigma reduce. I think some of that can be attributed to I place myself in spaces where people are actively working to reduce the stigma. So I see it reduced a lot personally, but I know that there are other college students who aren't in those spaces. And there's some students who will go throughout their whole college experience without seeking help, without having a support system, having a group of friends, or having NAMI or different areas that I'm plugged into who aren't seeing the stigma being reduced. But I think overall, it's definitely happening for sure.
Oh, that is so lovely. I wanted to point out that we're going to put a slide up with some helpful resources for you in our presenters or organizations and contact information. So if that would be helpful to you, yes, there it is right there. As I mentioned, we recorded today's forum and we'll be emailing that to you as well as to the resource and contact information for our panelists. You will be prompted to take a short survey after the forum. We do hope you'll take a few minutes to let us know how we did. I want to say a huge thank you to our panelists. You all are doing amazing work to end stigma and empower and inspire the people you serve. And thank you to everyone who joined us today. It was my absolute pleasure to moderate this community forum. I hope you gained insight that you can take out into the world and share. Thank you.